How do medical societies influence medical necessity guidelines? Imagine a team of medical experts working behind the scenes to shape the rules that decide what health services insurance will cover. That's exactly what medical societies do. They develop clinical practice guidelines that set the standard for what is considered medically necessary care. These guidelines are based on the latest scientific research and expert opinions, helping ensure that patients get treatment supported by solid evidence. When insurance companies decide whether to cover a procedure or service, they often rely on these guidelines to determine if it's justified for a specific medical condition. The process involves committees of experienced clinicians who carefully review current studies and clinical data. They look at how effective treatments are, what risks are involved, and what the best practices are. These committees then draft recommendations that reflected the consensus of the medical community. To make sure these guidelines are trustworthy, many societies now include independent reviewers and use formal systems to grade the strength of evidence. This transparency helps prevent bias and ensures that the guidelines are based on the best available science. Medical societies also play a role in advocacy and policymaking. They work with government agencies and insurance companies to align coverage policies with clinical standards. This helps protect patients from unnecessary hurdles like excessive paperwork or delays in getting needed care. By participating in policy discussions, societies aim to make sure that insurance coverage reflects current medical knowledge and best practices. From the perspective of health insurance, these societies provide critical expertise. Their guidelines help insurers decide what treatments are necessary and appropriate. When a service aligns with these evidence-based standards, insurers are more confident in covering it. This balance between scientific evidence, clinical judgment, and patient needs is vital for fair and effective health care. In summary, medical societies influence medical necessity guidelines by creating evidence-based standards, offering expert opinions, advocating for policy reforms, and improving guideline quality through rigorous review. Their work ensures that insurance decisions are grounded in the latest medical science, which benefits both patients and the sustainability of health programs. Always remember, for any medical decision, consulting a healthcare professional is essential to get advice tailored to individual needs.